All right, welcome back to another edition. And last week we started our discussion with Sonya Britt Lutter, who is a financial therapy legend. And I'm not her personal marketing
Not yet.
agent. And one thing that I brought up is in the treatment. I'm curious as to your take on this, because I guess I've been influenced by Gabor Mate and some of his work, which says that under every addiction there lies trauma. And when I look at financial behaviors that are often really hurtful to a person, not in a person's best interest, of which addictions aren't either, I typically run into a lot of trauma. And where the saying came from, it's not about the money. And I'm curious as to your thoughts about that, or what, yeah, just how do you frame that up? Because oftentimes I will use the word trauma around mental health folks, and it seems that even trauma itself, the word, has different camps and different meanings.
Yeah, it's a big question and certainly no easy answer. But really, when you introduce this idea of trauma, you are very clearly in the family systems arena, which means that anything that you adjust is going to have an influence on things that you can see and things that you cannot see. Addiction is one of the most beautiful examples of this. Take any celebrity that you want who's went to a rehab center. They were doing all sorts of crazy things. Oh, let's just send them to this 30-day program. They're living in this nice secluded area and they get better. They stop using drugs. They stop drinking. They look good. They look healthy. And then they get out. And then what happens? Every single time, back to the drinking and the drugs. Because you're taking that person and putting them right back into the same system that they came from. And people in that system, the people in the household, the spouse, the children, the parents, need that person to be using because it hides something else that's going on for them. If we pay attention to Susie's drug problem, you're not noticing Dad's abusive behavior, or you're not noticing that we just filed bankruptcy for the third time this year, not this year, this decade. And they're serving a purpose. And when they stop their addiction, it influences everybody else in that system, just like the gear shaft, right? And so to really be able to treat trauma or addiction, you've got to incorporate those other elements, whether it's there in the room or if they're not willing to be a part of that therapy experience, to at least be able to help your client know how to interact with those parts of the system so that changes can be made in a way that allows that person's gear to keep shifting in the way that they want it to keep shifting, because it's going to change the entire system. Whether they want it to or not, it will make an impact.
So when you bring that into finances, and the fact that finances typically are impacting more than one person.
Absolutely.
I mean, especially if there is a family.
Yes, always, right? Regardless if there's a family or not, because you got the money from somewhere. Work, inheritance, somewhere the money came from. So yes, there's already another gear right there.
And you're reminding me of working with couples.
Yeah.
And what I learned from Ted when I was working with him around that is you have the two partners, and then you have the coupleship, right?
Exactly.
So you really have three entities in the room. And uh, graduate course that I teach at GGU has a couple chapters on working with couples, which comes right out of facilitating financial health, right? And I can't tell you how many of the students that go through that course come out of the course deciding they're not going to work with couples in their financial planning firm.
I believe it.
And I'm like, well, wait a minute. I think we've gone too far here. You're going to have a pretty meager existence.
Well, I think it would be equally fascinating to throw it back at them. Does this person exist in isolation? Any client, because the answer is always no. So it's going to be complicating. Naturally, it's more complicating when the two people are sitting there in front of you. But even when another person isn't in that room, they are for sure influencing what the client does with their money.
Yes. And there's so many things. So I recently took some training in couples therapy. And that's another long story, but there's a part of me. The last place I want to be is where there's a couple fighting. Right? And I remember
it's not particularly fun.
Oh man. And I remember Ted, he'd almost get excited when a couple was fighting, like, oh wow, this is something to sort out. And I'm like, I am spiritually hiding under the heaviest piece of furniture in the room. Like, oh my God, somebody's going to die. And I thought as I went through this training, there is no training for CFPs in dealing with couples, much less psychological training, right?
Right.
Which is starting to shift with the publication of the Psychology of Financial Planning. But it just hit me that this is a unique, this is a unique skill set amongst therapists, right? Because not all therapists are couples therapists or even want to be couples therapists.
Precisely.
Would it be right? I've never thought about this before. Is it like a marriage and family therapist? Are they inherently couples therapists?
They are inherently relational therapists. Part of the degree requirement is to have, if it's not half, it's more than half of your training hours be relational, whether that's coupleship or multi-generation. But it is very much relational focus, and it's very much based in the systems approach. As compared to something like social work or something like clinical psychology that might be more individually focused, marriage and family therapy implies the relational element. It doesn't mean that the other occupations don't use relational therapy. It's just not a requirement of their programs.
So this is kind of like a duh moment for me because
it'll make me look brilliant. So let's see it.
I've just never thought of marriage and family therapy. Of course.
Yeah, both of those words are relational.
Of course. So, have you ever heard of internal family systems?
I have, from you, in fact.
Well, I start getting all excited because the founder of IFS, Dick Schwartz, was a marriage and family systems therapist. And he once said he was out, it was the be all end all to therapy. He was out to prove that this is where it's at. Mm-hmm. And then he ended up by applying that to the internal family system. So as you talk about the dynamics of the external family system, it makes a lot of sense in the training I've gotten when we just flip the mirror to looking at all those parts of yourself internally that have the same vested interests in the trauma and the wounding and all the relationship between the parts and things of that
Absolutely. Type. But that's harder. I don't want to look at my problems. I'll look at your problems and I'll tell you what you were doing wrong. But people have a really hard time focusing on their contribution to problems.
And that includes therapists, right?
For sure.
Yeah. That just blew me away. And again, it was Ted when I said, and I was raised in on-site in my therapy, right?
Mm-hmm.
It used to be in Rapid City.
Yeah.
And so that's the container in which I viewed therapy. That was normal. And I would see therapists in the groups. Like, I'm trying to remember a group that I was in that didn't have a therapist doing their own work, right?
Mm-hmm.
I just thought that was normal. And then he told me one day, I said, well, what percent of therapists do their own work? And he said something, and I said, 10%? He said, no, I said 1%. And I thought, that cannot be. That can't be. And when Sarah Swantner, when she worked for me and she was going through her master's in clinical therapy, she would tell me of the people that were in her class that it was just like, what, me? I want to be a therapist. I don't need therapy.
Mm-hmm. Just like financial planners, right? Not so different.
Well, exactly. Which is something that I did a lot of work in back in 2008 research on. Why don't financial planners have planners? And I think I even recently did a podcast that was, I think it was, oh my God, my financial therapist has a financial therapist. Should I be worried?
I have a great book for the listeners to read.
Yeah?
It's called Maybe I Should Talk to Somebody. And it's by Lori Gottlieb. And she's a therapist. And she talks about that inner struggle herself of her going to her own therapist and what that was like seeing the therapist while working with her own therapy clients. And it's really eye-opening in terms of that struggle and how much she benefited and how it made her a better therapist because she was on the other side of the table.
What's the name of that book again?
Maybe I Should Talk to Somebody or Someone.
Okay, great. I need to check that out and put it on my stack of 30 things to read. Yes, and then we could get into doing our own work, how important it is for practitioners, whether you're a financial planner or a therapist.
Mm-hmm.
And maybe well, I go down that rabbit hole all the time. So listeners of the podcast are
they're familiar.
Are pretty used to that. I wanted to get back to you on your career shift, right?
Yep.
So you spent 12 years, right, in academia.
I'm pretty sure that's right. Yep.
And then you shifted to the private sector, working as a consultant. How was that going from academia to the private world?
I don't know if any of the listeners will think this is funny or if they can relate, but the biggest eye-opener for me was the first time I went to make a purchase in the private sector. And I said, who do I ask for prior approval for this? Where do I send my receipt? And I got laughed at for both of them. So that's one thing I learned. But it was great because here's one of the key things I learned. There is still a lot of need out in the real world for more of this training. Just as you mentioned a few minutes ago, in terms of there's not really anything available in terms of couples training for financial planners until now, because that's what I'm doing now. But when I was working in the consulting space, that's one of the things I saw is that we, as financial planners, tend to portray ourselves as being very confident and competent, when in reality, maybe there are some missing pieces that could be improved upon. And yeah, really focusing more on those relational elements and how do you communicate to clients in a way that you feel comfortable and a way that they feel comfortable receiving that information.
How long did you spend in private practice before, when you got done with your MFT and then you went to Kansas State?
Texas Tech.
Or Texas Tech, right?
Yep, 2 years.
Okay. And what practice were you in then?
So I was doing private practice as a therapist.
Okay.
But doing the financial stuff, but that it wasn't really yet a thing to call it financial therapy. So I was doing therapy, working primarily with financial issues. And I, at the same time, was working at Head Start, which is a preschool program for lower income families.
Oh, sure, yeah.
And so I was doing therapy with the children and the families, but also financial counseling with the parents. As a low income provider of childcare, there was a lot of really dire types of situations, and helping people get their budget in place and helping them really analyze opportunities for maximizing the resources that they had is what I did there.
How did that inform you as an academic?
Yeah.
In private practice?
Yeah, it's been a very wild ride, if you will, from one end of the socioeconomic status to the complete opposite end of the socioeconomic status. And here's another thing I've learned is that we're all human and we all have the same desires. We all have the same set of values. And it's, yes, there are different struggles that come with lower income. There's also different struggles that come with higher income. But when you get down to what makes a person, it's what they value and how they live by those values. And you can do that across the entire wealth spectrum equally as well.
You remind me of when we were doing the on-site workshops. One of the things that we tried to do was discourage people from talking about what they did for occupation, or how much money they had, or anything like that, and just get to know each other on who they are, who they're showing up as. And that was one of the most powerful things of that program, is to discover after 5 days, then everybody would unveil themselves, right? And it's like, oh, I've fallen in love with this person who's an attorney, but I didn't know that, and I hate attorneys.
Isn't it fascinating?
And I remember one lady who was worth hundreds of millions of dollars. I remember her sobbing for 25 minutes deeply. That in that moment, I discovered that there was a place where a person can have too much. And this is not a dollar number, but that there was a place of where that can be harmful, and how the person deals with it. And I also remember her saying, my friends tell me nobody works harder than I do at being middle class.
Yeah.
And then in the same room, you can have somebody who's bankrupt. And it's all the same issues.
It is.
That present.
Yeah. So one of the passion projects that I've always wanted to do, and I've just never really had correction, I've never made the time for it, is interviewing people about their great loss. You know my personal history. And how are some people okay after a major life event and some people are not okay. And so I started interviewing people I know, and then they would tell me about other people or a friend of a friend. And so it's really snowballed into meeting all sorts of really wonderful people. And what I have gathered from every single one of those conversations is what helps people with their resiliency, with crawling out of a really horrible situation and surviving, perhaps even thriving past a great loss, is that they are a person. As an example, I am Sonya. I am not Sonya, a widow. I am not Sonya, a parent. I am not Sonya, a wealthy white woman. I am just Sonya, and that is who I am to my core. And other people, they haven't said that directly in their story, but they'll say, I am not XYZ. I'm not this. And I say, it sounds like you are you. Like, yeah, that is it. And what does that mean? Like, that we are living our authentic self, and that's what helps people live a wonderful life.
That is really profound. That was not the answer I was expecting from how do you dig out of a great loss, or how do you find that resiliency? And I'm going back to like when I first got into the ACA Adult Children of Alcoholics program. And I would, you just introduce yourself by your first name. And my family name had some prominence in our community because my dad was in real estate, and the name Kaler was on signs all over town, and people thought we owned the whole town, which was not the case. And I remember the profound sadness when one person discovered, after me showing up at this meeting for 3, 4, 5 months, when he found out my last name. Oh, he says, what are you doing here? And he caught himself realizing what he had just said and said, I guess you're here because you need to be here.
That's right.
But, and also, Sonya, I'm thinking of what very few celebrities or mega billionaires that I've dealt with, that they can't show up and be just Sonya or just Rick anywhere, right?
Right.
And what a precious gift it is that we can be seen for our essence and not for our fame or our money.
Right. Not what role we're playing in that moment, just your essence.
And it's kind of like that's one of those things that I always took for granted. I didn't even understand there was any value to that.
Mm-hmm.
And I think that's part of the healing journey, is when someone sees us for who we are, and we get that love and acceptance.
Yep.
Especially when we have laid all of our dirty laundry, all of our crap, everything that we're afraid is going to separate us from another.
Mm-hmm.
And then we get more love and acceptance.
Yep.
Yeah.
That takes us all the way back to the beginning, right? With the trauma. Like, how do you deal with that? Well, you treat a person for who they are, as their authentic self. You don't layer on all of the other pieces that have happened to a person. That is not who they are. Those are events or things or places that they've been done, but that's not who they are as a person.
What do you think about this belief? I've said before, sometimes I get pushback, sometimes I don't. And that is the thought that we're not traumatized by ourselves, typically. It's in relationship. It is at the hand of another human being in some way or not. And I don't think that we get out of the trauma unless we're in relationship with another human being.
Yeah. That's an interesting thought. And I can also tell you from the people that I have had the true honor to interview is that they always do bring up a key relationship for them. It's not usually a collection of people. It's one key relationship that really helped them get through that difficult situation. So to a certain degree, I do agree with you. To a similar degree, I disagree with you, because it's really up to that person and their mindset in terms of who they want to be. Do you want to be Sonya the victim? Do you want to be Sonya the widow? Do you want to be Sonya the lost one for life? Or do you want to be Sonya, the one who's living her life right now for what it is, as Sonya?
Yeah, that's really stressing being present, isn't it?
Yeah, it is.
Just being in the here and now, and what a journey that is. I mean, you hear that carpe diem, you hear that a lot. Just be present for your life. Well,
harder than it seems.
I did a lot of training with the Enneagram, Russ Hudson, and in the end of the day, he would say the Enneagram is all about that. It's all about how can I show up for this moment right now. So,
yeah.
Oh, Sonya, that said, I think we're running out of time. If I'm doing the math right, as I look at the ticking clock. This has been just an extraordinary privilege and honor.
Thank you. I appreciate it. It brings me back to onsite.
Yes. Yep. And just everything that you have given to the profession, given to financial therapy. I so much appreciate your leadership, and who you are is just so phenomenal. And I am wishing you just the best of success in your foray into in being a business woman.
Thank you. I appreciate it.
Well, thank you. And thanks everybody for listening. And we'll look forward to talking at you again next week.
Bye.